Good morning, everyone. Good morning, Tara. The members of this group are consist of Mary, Rochelle, Priscilla, and me, Myrene, as your first speaker. Our group chose to tackle individualism versus communitarianism in healthcare decision making, specifically the controversial and debatable euthanasia in the Netherlands. We chose this topic because it evidently highlights the ethical dilemmas faced by healthcare professionals that most of us can relate to when balancing the autonomy of the individual with the well being of the community and the implications of these decisions on society as a whole. At the heart of this discussion, we will learn more in depth about the two contrasting concepts, individualism and communitarianism. These two concepts significantly shape healthcare decision making and the roles that family member plays in the process. By examining how these concepts influence healthcare decision making and the involvement of family members, we can gain a deeper understanding of the implications of euthanasia. Ultimately, the debate over euthanasia in the Netherlands reflects a larger societal conversation about the balance between individual freedom and the well being of the collective. For further explanation of these topics, our second speaker, Mary, will elaborate it more.
Thank you, Myrene. Good morning, everyone. Good morning, Tara. So, yes, in this presentation, we are focused more on the healthcare aspect of um, the values or the influences of individualism and communitarianism in the Netherlands. So, how do the values of individualism and communitarianism influence patient decision making process in the Netherlands? Um, I will be talking about each value. So first, I'll talk about individualism. In the Netherlands, individualism um, it concentrates on patients' autonomy when we relate it to the healthcare decision making. While the communitarianism, it's more of the collective health outcomes that is being emphasized. And so let's start with individualism. Like what Myrene mentioned, we're going to be using euthanasia as a good example. And if you could switch to the next slide, please. So there is a study that we came across. It's a cross-sectional study design that shows um, that according to the cultural psychological examination of individualism and collectivism in 5 European countries, according to the author who did this study, which is Lucia Yu and the other authors, um, Sweden and Netherlands are very individualistic countries when they did this study. Yeah, so the result shows out of 5 European countries, Netherlands is one of the very individualistic country. It's probably one of the best example that we can talk about is the euthanasia. And when we say euthanasia, it's like being legalized. It's an assisted dying or an assisted suicide for those who are very ill or very sick, or those who has psychological issues or feel like elderlies to feel like their life is being completed. They wish to request for a euthanasia as an autonomous choice or as a right in the Netherlands. So there was this research by Cohen Havens and the other authors, and according to that research, in relation to euthanasia in the Netherlands, they have reasons to believe that the approach to euthanasia um, as a practice based on physicians' conflict of duties, it's shifting towards euthanasia as a practice grounded to patient's choice, which is it's very obvious, is a very obvious example of an individualism value, because patient has the right or autonomous choice to request for such assisted dying, right? Personal responsibilities. They already did informed consents, and it means that they already know the treatment options. Their doctors already told them what are the best possible care, and but then still they resort to the euthanasia request. Um, so yeah, so this means that individuals are responsible to their own health, making informed choices about treatment options, like I mentioned, personal freedom and self-determination. Basically, individual rights are very central to their healthcare practices in the Netherlands. So we can conclude that really it is an individualistic country. Patients are fully informed about the risks, like what we mentioned, the euthanasia, before they will be granted that request. A doctor should follow the criteria of due care, and if those are met, then that's when they grant the wishes of the patient. But then if it's not, then they would resort to palliative care, other psychosocial care, or other like support from families, other than assisted dying. And if the patient, let's say for instance, is not going to resort to that palliative care or other cure or other care that the doctors would that would recommend other than euthanasia, then they have the autonomous or they have the right, rather, to go to a end of life clinic wherein there's a group of nurses there in that clinic, group of doctors that can help them without being judged, that can help them fulfill their wishes for euthanasia. In addition to that, there is also according to Cohen Heaven's research about the developments of euthanasia in the Netherlands, there is also a public initiative that aims to legalize assistance of those elderly people that, though they don't have any sickness, they feel like their life is being completed. Like, say, for instance, they feel old already and they don't want to suffer, like for instance, any disease in the future. So they're just being in advance that they don't want to suffer, so they use that right or that choice to request euthanasia even if they're not suffering. And yeah, this public initiative is being developed in the Netherlands as well, because initially it was more of those who are for the people that are suffering, but this one, they are looking into this. So it really boils down on the individualistic side of the values of the people from Netherlands, because they do exercise this right, that it is their right to, you know, personal, or like their autonomy to choose whatever their life will be, like how they will or determine their life, whether it be palliative care or end of life. So that is all about individualism. And while the healthcare in the Netherlands shows a shift towards a greater emphasis on patients' rights, according to those research, there are some influences of communitarianism in the Netherlands as well. And like I mentioned earlier, it is focused more on the collective well-being of, or collective outcome of a specific community or as a whole. So for example, the legislations that the government has provided is giving an impact on the Dutch healthcare system. For those legislations are the Social Act, Long-Term Care Act, the Health Insurance Act. So those particular legislations, they are focused more on it's like an integrated healthcare delivery that the Netherlands has. And I got this from a research by Kirk Warden. It's called the accountability in healthcare in the Netherlands. So the next slide will provide us the different examples of the social or the different examples of the legislation. So the first one, according to the research or Kirk Vorden's research, um, Social Support Act, which focuses on overall health of the population. So municipalities are responsible for assisting people who are unable to independently arrange the care and support needed. Also, the Health Insurance Act, which finances healthcare and do mandatory insurance across population. Equitable access to healthcare services for all citizens despite health conditions. Long-term care stay in like institutions, nursing homes, mentally disabled homes. So basically, like healthcare governance, it's being made or provided by the Netherlands to emphasize collective health outcome or good public health outcome. So it's a shared responsibility, which I can relate this to communitarianism, right? Because every sector of that healthcare integrated delivery system is held accountable if in case something happens. So for example, let's say no, not euthanasia. We can talk about it more later. But the good example that I can think of is the COVID-19 pandemic. So, as a community, the Netherlands it's a shared responsibility for them to get vaccinations or get vaccinated. Um, but I know I mentioned earlier that this country is very individualistic, and they have the right to like not choose to get vaccinated. But um, on the public health side, they have to get vaccinated because it's basically a shared responsibility. It's a collective health outcome for the entire population in the Netherlands. So, this integrated or this vaccination thing could be also a debatable issue. But we could say that communitarianism plays a role in there because, it's a public health that is being at stake. So, like I mentioned, every sector, stakeholders, hospitals, doctors, patients, they are being held accountable for their own health in this area under communitarianism. And yeah, basically, um, individualism, to wrap it up, it's basically patients' right choices or autonomous choices, whereas communitarianism is like emphasize collective health outcomes as a whole, and it involves universal access to care, shared responsibilities as a community in the Netherlands.
Thank you, Mary and Myrene, for that wonderful explanation. And because we are dealing also with the family rules, so let's talk about family culture in the Netherlands. So basically, I can just give you a quick background. So family rules in Netherlands have this evolved significantly in the when it comes to individualism and greater gender equality. So, family rules, for example, the Dutch children are encouraged and allowed to have a strong training in the independency. And also, when it comes to parental guidance, so parents, mother and father, have the equal responsibilities in child rearing or in work so they have this work life balance as well as so for example, whoever is the one who will support while doing the home chores, child taking care of their child, and also who's the one is working, so they have strong responsibilities and focus when it comes to the balance in a particular area of gender. And uh, because we introduced the example of euthanasia in the family roles in individualism and communitarianism, so basically, family has a greater impact and influence when it comes to end of life support. So when it comes to care plan, decision making, treatment options, so support in a emotional dignity and comfort, family can be a great advocate in this area, especially with those involved or a member of the family who has been in the end of life care. I mean, in the end of life, who needs to be supported. And for example, if this family member cannot be, I mean, he or she cannot have this proper decision making. So family will provide the best support as much as possible for that individual who can get the best treatment options. And also, yeah, that's it. When it comes to medicine and the accessibility, so the family support is the best guidance for that individual. But at the end of the day, patient autonomy, as what Mary say, has the final say of the decisions of the end of life care, whether he want to go to this area, he want this best practice from the healthcare provider, whoever, what he choose, who he choose, is the individual who is suffering from the end of life. And let's go to the conclusion. Can I give the floor to Priscilla?
Thank you so much, Rachel. So in conclusion, we believe that in Netherlands, healthcare decision making reflects a unique balance of individualistic and communitarian values. This approach emphasizes the importance of personal autonomy, ensuring that the patients have a strong voice in their healthcare choices and are empowered to make decisions that align with their personal values and needs. At the same time, Dutch healthcare also acknowledges the significance of collective responsibility, and this perspective encourages shared responsibility where healthcare providers, patients, and society collaborate to promote the common good and equitable access to care. And that's the end of our topic for today.
Thank you.